belt buckle trainer, teaching you some soft tissue mobilization techniques for the quadratus lumborum. Back there, see our lovely skeleton. The blue tape indicates the quadratus lumborum. On the iliac crest, it's going to originate. It's going to insert into the 12th rib. You're also going to have insertion points on L1, 2, 3, and 4 on the splenius processes. So what we're going to do, it's very common for clients. Right now I have a client, she's battling with some low back pain. It's not shooting, it's not radiating. We've talked with our therapist. We have eliminated any red flags, sciatica, and so forth. That's why it's so important to have a physical therapist part of your team, as we do at Show Up Fitness. I have our awesome instructor here, Megan. She teaches the trainers in our 2-month internship to get your Show Up Fitness CPT here in Santa Monica. I'm going to demonstrate on her the quadratus soft tissue mobilization technique, and then we're going to go over some exercises for mobility as well as strengthening, and then she'll also do it on me. I typically suggest using your thumb. Always have your client sign a waiver, but set very clear expectations on what we're going to be doing. We're not going to be mobilizing the spine. We are literally going to go right next to the spine into that muscle. We're going to hold, find that discomfort level, 5, 6, 7, hold at the 7, implement parasympathetic breathing for a good minute. Maybe halfway in, you're going to press a little harder. Communicate very clearly with your clients. If anything feels weird, you stop immediately. This is within our scope as personal trainers. I'm going to demonstrate where you would locate, so the splenius process of the lumbar region. We're going to go on the lateral side. We are going to look at this area right here, and I'm just going to press down. So she turned her head. I would like her to be in front of a mirror. How's that feel, Megan?
It hurts.
It hurts. On a scale of 1 to 10?
Like an 8.
Okay, 8. Hold there, breathe, big breath. I'm not massaging her. I'm not digging in. I find one spot, apply pressure to bring it up there, hold. Usually 3 to 5 breaths will help. And then when it comes down, you're just going to give a little more pressure. And just communicate with me when that discomfort level comes down.
It's starting to come down.
I have a client right now that experiences a lot of discomfort in this area. She runs a lot. The quadratus lumborum is an extensor unilaterally, also a contralateral pelvis stabilizer. It's going to lateral flex and work with some breathing. When I do this technique on my client, you will see short breaths. That is not what we want. Calm down, breathe through it. Sometimes I'll do this for up to 2 to 3 minutes in extreme cases, but I call it the zit effect, because when you release, it's like, oh, wow, it's like a mini orgasm. It feels great. And then your client will move around, and a lot of times you're like, holy crap, that feels great. Now it's time to go move. Show some mobility drills, exercise we'll get into next. And then at the end, it's great to do it again if that's something that they want. Having a massage table is a great investment as a trainer, because you're separating yourselves from the average trainer who's just doing a bunch of corrective exercises and simplifying pain. Do a thorough analysis, communicate with your therapist, learn these techniques, which we teach in our level 2 certification. We have 8 to 10 areas that we're going to work with releasing. We're working with the brain here to calm it down, and then we're going to go move. So if you got to be very appropriate with your client. You're not going to say, take your shirt off. Nothing wrong with Megan wearing her sweater there. It's what your client feels comfortable with. You're going to find the PSIS, which is your posterior superior iliac spine. So on the back side right here, that's the PSIS. This is the ASIS, anterior superior iliac spine. You're just going to go above and deep. So the superficial muscles are your erector spinae. The deeper one is going to be the quadratus lumborum. You can use your thumb, and that's what we're going to look for right now. Better. So right now, it's very common when you're doing this for the first time, the pressure that you apply is very weak. So that was about a 1 out of a 10 right there. That was nothing. You got to dig in there. So come up a little bit. Come up a little bit. There you go. And then really get into it. There you go. Great. That's right there. Yep. As I was mentioning earlier, you know you really hit it when you get those sympathetic breaths. We do not want that. When that threshold, that discomfort level gets to 7 or an 8, hold. I don't want to press so hard when they go, ow, 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 ow. No, it's not the point of this. It's just to bring that discomfort level above where it's currently at. Apply a little harder. You can go a little harder. There you go. Hold. If you need a brace with the other hand, as she was kind of doing on my pelvis, that's all right. Be very professional in your hand placement. You're not going to be touching your client's glutes. You're not going to be manipulating the spine. We cannot stress that enough. You're getting into soft tissue. It's the same as if you had a lacrosse ball or anything along those lines. You can just get in there a lot more specific. And then when you relax, when she takes her hand off, you'll notice the area, if they were to have skin showing, would be a little red. That redness indicates blood flow. We are manipulating one of the largest organs of the human body, which is the skin. Actually, the largest is your muscle group, but your skin is very large as well, and it's going to be sending afferent messages back into the spinal column. A lot of times your client will be like, oh wow, I couldn't even get out of bed, and now, oh wow, it feels significantly better. Great, let's go and do some exercises now. We're going to go over some mobility drills. We've already done the soft tissue technique. If you do not have a massage table, you could also set them up in this position and do the release technique, which you would just go right into the side, and they really get that stretch across their body. Remember, the quadratus lumborum works with forced exhalation because it depresses the rib cage. So what I want to do is put this hand down, and then you can kind of sit your hip back into it, and you can make it into a little mobility drill where you just go into that stretch and you come back. This is great, hits all the 10 checkpoints of human movement: ankle, knee, hip, lumbar, thoracic, cervical, shoulder, elbow, wrist, and then the breathing. We're set up in this position with your opposite leg abducted, and then she's going to reach over. I like adding a band because it just gives that extra emphasis. Pull, she's sitting back into it, so she's hinging on the right leg, getting a good adductor stretch, but really isolating this muscle, the quadratus lumborum. You could try throwing in an exercise if you wanted to do some rows, so just come across the body and do like a little row when you come up. And then it comes back and you kind of sit back into it. Some dynamic stability involved here. And these are fun. We got our butt walks, because as the pelvis rotates, you're going to be getting that muscle activated. Remember a lot of times with this injury, it's a tissue loading issue. So we just started running miles at a time and we aren't strengthening. I wouldn't do 10, 15 exercises, because if the tissue's irritated and you throw on top of it a bunch of overloading movements, then it's going to make it worse. 2, 3 low sets, maybe 1 or 2 sets. She can even go back 8 to 10 repetitions. I would do the stretch one first, and you could do a couple exercises here. I will show you one more for strengthening. And then you abduct, super slow eccentric. I love this exercise because it really just hits everything. You're getting the glutes, you're getting the hip flexors, you're overloading the quadratus lumborum. Remember, this is a tissue capacity issue. There's no radiating down the leg. And so we'd probably want to avoid RDLs because that's going to be extending. Probably would want to focus more on a sumo because the spine's more upright. When you're doing exercises like a unilateral row, it could just irritate it. So we want to work around it within reason. Communicate with your client. The next day is super important. My current client gets really irritated when she goes to Orange Theory and she runs for 24 minutes. It's going to be hard to really help her because she comes in here, we get stronger, then she goes out there and she's doing all these sloppy reps. But what I can do is give her some exercises she can do at work. And then the soft tissue mobilization technique is a game changer. It's always great when I will show that. You can look at it on Instagram. When I release, she's like, oh my God, like it feels great, I can get up. So we are helping little by little. These are going to strengthen, and then hopefully in the future, it's going to go away. Work with your physical therapist, get your level 2 certification, and keep showing up.